Cramps, also known as nocturnal leg cramps or Charlie horses, are a common and painful phenomenon that can strike anyone at any age. These sudden, involuntary muscle contractions can occur during the day or night and can last anywhere from a few seconds to several minutes. Leg cramps can be a source of great discomfort and can interfere with daily activities and sleep quality. In this video, we will explore the causes of leg cramps and discuss various methods for prevention and relief. Causes of muscle cramp.
1. Muscle fatigue. One of the most common causes of leg cramps is muscle fatigue. Overworking the muscles, especially during intense physical activities or prolonged periods of standing or walking, can lead to muscle exhaustion and cramping. Athletes, in particular, are prone to muscle fatigue-related cramps due to their strenuous training routines. 2. Dehydration. Dehydration is another leading factor in the development of leg cramps. When the body lacks adequate fluids, the muscles can become more susceptible to cramping. Dehydration can occur due to inadequate water intake, excessive sweating, or certain medical conditions. 3. Electrolyte imbalance. Electrolytes are essential minerals like calcium, potassium, sodium, and magnesium that help maintain muscle function. An imbalance in these electrolytes, often caused by factors such as poor diet or certain medications, can lead to muscle cramps. 4. Poor blood circulation. Inadequate blood flow to the leg muscles can result in cramps. Conditions that restrict blood circulation, such as peripheral artery disease or sitting for extended periods, may increase the likelihood of experiencing leg cramps. 5. Nerve compression. Nerve compression or impingement can also trigger leg cramps. This occurs when nerves that control muscle contractions are compressed or irritated. Conditions like herniated discs or spinal stenosis can lead to nerve-related cramps. 6. Medications. Certain medications, such as diuretics, statins, and asthma medications, have been associated with an increased risk of leg cramps as a side effect. Prevention and management of leg cramps. Thankfully, there are several effective strategies to prevent and manage leg cramps. By addressing the underlying causes and making lifestyle adjustments, individuals can reduce the frequency and severity of leg cramps. 1. Stay hydrated. To combat cramps caused by dehydration, it's crucial to maintain proper hydration. Aim to drink an adequate amount of water throughout the day, especially if you are physically active or exposed to hot weather. Sports drinks containing electrolytes can also help replenish lost minerals during intense exercise. 2. Stretch regularly. Stretching your leg muscles regularly can help prevent cramps. Focus on stretching the calf muscles, hamstrings, and quadriceps. Incorporate gentle stretching exercises into your daily routine, especially before and after physical activities. 3. Maintain a balanced diet. A well-balanced diet that includes sufficient electrolytes like calcium, potassium, sodium, and magnesium can help prevent muscle cramps. Foods rich in these minerals include bananas, oranges, spinach, nuts, and dairy products. Consider consulting a healthcare professional or nutritionist for personalized dietary recommendations. 4. Adjust medications. If you suspect that your leg cramps are a side effect of medication, consult your healthcare provider. They may be able to adjust your prescription or recommend alternative treatments that are less likely to cause cramps. 5. Address underlying conditions. If leg cramps are due to an underlying medical condition like peripheral artery disease or nerve compression, it's essential to address the root cause. Consult with a healthcare specialist to develop a treatment plan tailored to your specific condition. 6. Improve blood circulation. To improve blood circulation in the legs and reduce the risk of cramps, consider activities like walking, swimming, or cycling. Elevating your legs when resting can also help promote better circulation. 7. Massage and heat. Massaging the affected muscle during a cramp and applying heat, such as a warm towel or heating pad, can provide immediate relief. Heat helps relax the muscle and increase blood flow, reducing the intensity and duration of the cramp. 8. Natural remedies. In addition to the preventive measures mentioned above, several natural remedies can help alleviate leg cramps and provide relief when they occur. A. Magnesium supplements. Magnesium is a mineral that plays a crucial role in muscle function. Some individuals may benefit from magnesium supplements, especially if they have a magnesium deficiency. However, it's important to consult with a healthcare provider before starting any supplementation. B. Epsom salt baths. Epsom salt baths can help relax muscles and provide relief from leg cramps. Dissolve Epsom salt in warm bath water and soak your legs for 15 to 20 minutes. C. Quinine, with caution. Quinine, a medication used to treat malaria, was once commonly prescribed for leg cramps. However, due to potential side effects, including heart rhythm disturbances, its use for this purpose is now discouraged. It should only be considered under the guidance of a healthcare professional. D. Herbal remedies. Some herbal remedies, such as valerian root and cramp bark, are believed to have muscle-relaxing properties. However, their efficacy for preventing or treating leg cramps requires further research. Hydration with electrolyte drinks. In addition to water, consider drinking electrolyte-rich beverages to help replenish lost minerals and prevent cramps, especially after vigorous physical activity. When to seek medical attention. While leg cramps are often harmless and can be managed with the strategies mentioned above, there are situations where medical attention may be necessary. Frequent or severe cramps. If you experience leg cramps frequently or if they are particularly severe and long-lasting, consult a healthcare provider. This could be a sign of an underlying medical condition that needs evaluation. Muscle weakness or atrophy. If leg cramps are accompanied by muscle weakness or atrophy, muscle wasting, it may indicate a more serious issue and should be investigated by a medical professional. New medications. If you start taking a new medication and experience leg cramps as a side effect, contact your healthcare provider to discuss alternative treatment options. No improvement. If you've tried various home remedies and lifestyle changes but see no improvement in your leg cramps, consult a healthcare specialist for a thorough evaluation. Conclusion. Leg cramps are a common and often benign condition that can be managed and prevented with a combination of lifestyle adjustments, natural remedies, and, in some cases, medical intervention. By understanding the underlying causes and taking proactive steps to address them, individuals can reduce the frequency and severity of leg cramps, improving their overall quality of life. If you experience persistent or severe leg cramps, consult a healthcare provider to rule out any underlying medical conditions and receive appropriate guidance on managing and treating your symptoms. If you like my video, then subscribe to my channel. Thanks for watching.